is a two-day conference to formally unveil the geriatric social care subsector in Nigeria. Key stakeholders across the health sector have gathered to witness the unveiling of the policy documents that will guide the provision of quality care to senior citizens in the country. With the launch of the National Policy Guidelines for Geriatric Social Care, as well as the inauguration of the Training Centers and Skills Council, Nigeria is set to tap into the potentials in this sector.
How are we going to build it to become such an industry as it is abroad? And I tell you, we have already started by first recognizing there is a system, by first developing all the articulating and developing and publishing all that everybody needs to know in terms of regulation, because standard first, because it has to do with life and rights. Not only the right of older persons, but the right of the caregivers.
The National Senior Citizens Center, which is under the Ministry of Health and Social Welfare, also inaugurated the first batch of geriatric units in 20 teaching hospitals across Nigeria. The teaching hospitals will provide training for professional caregivers. President Bola Tinubu, who was represented at the unveiling, says this is a sustainable way of rendering quality care services to the elderly.
It's not just about the capacities of those working also in the institutions, including the caregivers that are at home. We'll also extend those training because a lot happens within the home. So home-based care is another approach that we are also promoting.
The Federal Ministry of Health and Social Welfare is committed to the health care for the aged through the provision of clinical care, training, and research and health sector support, with a vision to achieving affordable universal health coverage for the aged.
It is not a federal thing we are doing. The federal guidelines, so everything is national, but we now brought in the states. First, we make sure that the first batch of training providers are states and federal university teaching hospitals or federal universities that are located across the country. We had 22 states here. Why did we do that? Because we want every state to have a training center.
The National Senior Citizens Center Strategic Plan 2022 to 2032 and the National Plan of Action on Aging details in clear terms the development of paid skilled workforce for geriatric social care sector, the development of the national benchmark and minimum standards in training and certification of caregivers, care agencies, and the development of career opportunities for identified competencies.
It's going to create an opportunity for people to make money out of caring for elderly people. All our young people that are going away out, what do? They go outside to work in care homes. That's what they do, and they earn big money, and they send a lot of money back here. So we are saying, yes, we do the same thing. We train caregivers. Caregiving is a skill, and if it is a skill that you are properly trained for, then you should be paid properly for it.
The long-term goal is to build an expansive geriatric social care quality assurance system in Nigeria. Georgina Ndukwezainka, Arise News.